We are live, sir.
Good evening, everyone.
Hi, a very good evening, everyone.
I hope the audio and video is fine. Can you please confirm whether it is fine? Good evening, Dr. Nachiket.
Good evening, Dr. Rajat.
The audio and video is fine. I think. Okay, so let's hope that this is the last evening and the night of this stress. And from tomorrow, you all will be a free bird. And I know that it's a very, very stressful night today. I and me, Dr. Nachiket, and all teachers, staff of Dr. Bhatia Medical Institute will try and will pray from the Almighty that you all get your dream seat tomorrow. Tomorrow should be the best day of your life, and we will all pray from the bottom of our heart that you should get what you are looking for. Dr. Nachiket.
So, guys, I totally agree with Dr. Rajat. I believe today is going to be the last night of struggle, and I'm 200% sure that you and each one of you is totally prepared for what is going to come tomorrow. And I'm repeating in every video of mine that tomorrow you are going to play the Virat Kohli inning for the T20 World Cup. Your country needs you, your parents need you to make them proud, and tomorrow's the day you are going to get that match winning score and you are going to make India proud.
Yeah, I believe that they have to play their best inning tomorrow. I mean, do not think about anything else. है ना, चक दे इंडिया का एक स्टेटमेंट है ना, ये 90 मिनट कोई तुमसे नहीं ले सकता, है ना. So that's the same point. These 3.5 hours are yours, and you have to play your best shot in this. You have to play your best inning tomorrow. For completely forget all the stress that you have. I am telling you that the God is making the paper for you. The paper will be created in the way so that you will be knowing it. So don't go into the stress at this stage. It will be a great paper for you if you trust the process. And I trust that process. I am very, very sure that the things gonna happen in the best way that is destined for you.
I
Dr.
can
Nachiket,
totally
would you like
understand.
to? Yeah.
Yes, I can totally
So would you?
understand that you must be going through some mixed emotions. You might be nervous, you might be anxious. It's all physiological. There's nothing to, worry about. Last minute hai, hoga hi hoga. But the perspective is neither this is your first exam, neither this is your last exam. It is just something which has come in your way to the success. Take it as a pit stop. All right. Tomorrow, you have to think about how much struggle you have put in. And tomorrow, when you sit doing that exam, block every thought that's coming into your mind. Every thought. Behave like a robot, a machine that for the next 3.5 hours, these 200 questions are your only focus. They are your only worry in your life. And your brain will be working in the maximum possible efficiency. Tomorrow, that's your only goal. That's your only focus. So don't let anything disrupt what you are thinking about. 200 questions, give it your best. And I think I have a couple of points. Dr. Rajat, if you would like to add something before I move on.
Yeah, please. No, please go ahead.
So, guys, I mean, tomorrow, the most important thing that you need to know, I'm sure that the people who have, far away centers have already reached there. If not, get a proper transport arranged. Do not, rely completely on public transport. Keep a backup possibility available. I know in multiple areas there are, rains and everything. So keep a backup possibility available. For the documents, you need to have a color printout of ID and admit card. And for the ID, make sure it is try to have it the same that you have admitted in the admit card process. For the study
Bhai,
plan or anything,
I think they need original ID also.
yes, original ID.
Yeah.
Original ID, but of the same that they have done while they were filling the application form.
Yeah.
All right. And the night before the exam, I think tonight is very important for each one of them. Please avoid caffeine. It is just going to increase your anxiety and will not let you sleep. And you will sleep late and you will wake up late. So it's going to spoil the process. Try to sleep by 11 to 12 p.m. maximum. Keep the phones aside and completely focus on sleeping. And while you are sleeping, I'm sure your brain is going to go on an overthinking drive. गिव योरसेल्फ पॉजिटिव रीअफर्मेशन कि कल बहुत बढ़िया होगा, मैंने सारी तैयारी कर रखी है, कल मैं रैंक 1 लाऊंगा. These kind of positive words are going to motivate your brain, your soul, and your heart. And keep a calm mind when you're actually entering the exam hall. That is the most important point. Dr. Rajat, if you would like to add something.
Yeah, I mean, 3 points. First is you should have a colored copy of your admit card, and that is back to back. है ना? I mean, do not keep on getting that fight कि मैं अलग अलग पेज पर लेकर आ गया उसको. Then you are fighting with the person who is, है ना? It's very clearly written back to back colored copy of the admit card, original photo, government issued photo ID, the one that you have submitted at the time, and your SMC, State Medical Council, or NMC, provisional or permanent registration. These are the three documents. If you are a diabetic person or because of a health reason, you need something, you should have a backup medical certificate related to that. And those are the things. Please make sure that wear light clothing. एक बड़ा इंटरेस्टिंग मैसेज एक स्टूडेंट ने भेजा, सर सिंपल है, फकीर की तरह जाना है. हाँ, तो बिल्कुल फकीर की तरह जाना है. So I mean, no significant ornaments. Then they will ask you to remove the ornaments, and that will unnecessarily create a hassle. And I always say that if somebody can accompany you to the center, that is the best thing. But if somebody cannot accompany you, then try to reach at least 1 hour earlier before the scheduled time. So those are the small points from my side. Have, if you have in the evening session, have a decent breakfast as well as a decent lunch, light lunch, not very heavy lunch, and I am telling you, everything will be good. As far as 5 sets are concerned, follow the same philosophy that I told you, that each set is a different set. The negative memories of the first should not go into the second part, should not go into the third part. So try to follow um, a 40 minutes, 40 minutes, 40 questions approach rather than 42 minutes, 40 question approach. That means 40 questions should be done in 40 minutes. 1 minute is to see something and 1 minute is to relax, to go to the next. है ना? जैसे आप 3 रन भागते हो, after taking third run, if the bowler comes back to ball, you say, भैया रुक जा, सांस लेने दे. So between the first part to the second part, take 1 minute for yourself so that you can breathe easily. And you can breathe so that the negative or the positive memories of the first set are not going into the second part. That is what my suggestion would be. Don't worry too much about the negative marking. The law of probability is very simple, that for every correct answer you get +4, for every wrong answer you're gonna get -1, है ना? So eventually everything will come out to be good. The standard suggestion is, if you can rule out one option out of the four, don't even think of leaving that particular question. Definitely mark that. Regarding the changing the answers of the questions, if it's a factual question, usually the first answer that comes to your mind is a correct answer. Unless you get a new information in the question, there is no point changing the answer of that. And you people have done a significant amount of hard work. I'm telling you, in I'm teaching for last 18 years. I have not seen a batch who has struggled so much for an exam. In the last 18 years, I have not seen any batch as a group, as a batch, who has struggled so much. There has been a lot of challenges for you. The God is gonna balance it out for you. If you trust, if you believe on somebody, if you believe on a process, it is gonna be balanced out for you. But you have to believe on that. With those positive thoughts, I believe that you should also sleep. You should get up. That I have done a lot of hard work. and there is no question that I will not get the rank that I am looking for. That's all. These are the points at my end. Dr. Nachiket, over to you.
So, moving on with the some affirmative actions on the exam day tomorrow morning. You need to follow your morning routine normally. Please do not take any extra stimulant. You have to plan your arrival, as Rajat sir just said, plan your arrival at least an hour before the scheduled time. You have to take some buffer for unnecessary delays. No new medications in the morning. Stick to your usual. Avoid any new drug. It's a very important aspect. And have a very light breakfast. No carbohydrates, minimum carbohydrates. All right. Avoid heavy or junk food. In the exam venue, I'll just add on what Dr. has just said. Use the deep breath technique. Many a times you will feel कि यार समझ नहीं आ रहा इस एग्जाम में क्या हो रहा है, एग्जाम मेरे बाहर, एग्जाम हाथ से बाहर जा रहा है, एंड उस टाइम पे बच्चे गिव अप कर देते हैं. So if you face such a scenario, I would advise use the deep breath technique. All right, inhale slowly, exhale slowly, and utilize that time to get your get your brain back in action. It's very important if you get stuck up to a question और तुम्हारा एकदम से दिमाग खराब हो गया कि यार क्या हो गया मेरे साथ, उस टाइम पे use that technique. I think Dr. Rajat just told you how you have to utilize the time, how you have to rule out options. Dr. Rajat, if you could do me another favor, एक बार दोबारा बता दो boss, how to rule out a question once if a student is stuck.
So, see, first of all, let's divide the questions into two groups. One is a factual question, which is a one liner, one is a clinical question. The simple tricks are very simple. In a clinical question, do not forget to pay attention to four words: age, gender, not accept. And these four words has to be paid very, to be seen very, very clearly. If the question has got more than two lines, the first thing that you should read is the last line of the question and then four choices. You're gonna take less time into that. Even if you're able to rule out one option out of the four, you have to make sure that you're marking the answer. If you're stuck between two options, follow the nota technique, which we have already spoken a lot of time. Use that in order to reach to the correct answer. The chances of you being correct is 80%, right? Now, if it's a factual question, try to recall that fact. Try to recall that what kind of fact, and also try to recall that what is the common confusion that the people can have. For example, somebody asks you a periventricular calcification on NCCT head, and you're thinking, okay, periventricular calcification, CMV or toxoplasmosis, है ना? So that someone suddenly you should remember, okay, periventricular in cytomegalovirus. Yeah, Bogdalek hernia. Is Bogdalek hernia is what? Posterolateral or or right or anterior. So BPL, Bogdalek posterior left. Try to remember that why this question has been asked, what is the confusion that the examiner can think about that. Think about the common exception. Is it a part of the exception or is it a part of a rule? And those, using those principles, I am sure that you will be able to score better than the others. Now, those are the very, very standard ways that you have to go forward. Age, gender, not accept. You have to make sure that in any clinical question you are not missing any of these words. And those are the standard principles. That's all from my side, Dr. Nachiket. I will pray from the Almighty from the bottom of my heart that all the students should get the rank that they are looking for. They should get the branch of their choice in the college of their choice. With this, from my side, I will wish all of you the bestest of the luck, and let's pray that tomorrow you can come and say, sir, I did my best. And that is what I am looking for. I'm not looking for anything else. All that I'm looking for is you are saying, sir, I did my best. That's all from my side. Dr. Nachiket, over to you.
So, guys, thank you. Very well summarized by Dr. Rajat. There are a few more points for tomorrow's exam. Of course, while attempting the paper, you are going to use the block strategy. Sir has just told you 40 minutes, 40 questions. You can keep 5 to 7 MCQs for review, especially the clinical ambiguous one. And for the marking strategy, there's one special point which I would like to mention in NEET PG. If you mark a question and you put it for review, that question will count. I think a lot of people have that particular confusion. You mark a question, you mark an answer, I'm sorry, and you put it for review. That particular answer will be counted in your main score. Sir, I'll again ask a simple question. How many questions should a student attempt if they plan to have the top 100 rank, or what should be the average number?
Bhai, according to me, the rule is very simple. The higher or the better rank that you are looking for, more is the risk that you have to take. It's as simple as that. If you are aiming for a rank in top 100, your attempt should be very, very high. Your attempt should be in 100%. That means 200 out of 200. Lower limit, if you ask me, more than 195. That's all. Now, if you are looking for कि नहीं यार मेरे को नहीं चाहिए टॉप 100 में, जैसे जैसे आप, सिंपल है ना, रिस्क है तो इश्क है. जितना रिस्क टेकिंग बिहेवियर है, चांसेस ऑफ गेटिंग अ हायर रैंक इज दैट मच, बट द रिस्क इज आल्सो द सेम. इट्स एज सिंपल एज दैट. अगर अटेम्प्ट ही नहीं करोगे, रूल याद रखना, आपके कम नंबर इसलिए नहीं आते क्योंकि आपके नेगेटिव ज्यादा होते हैं, इसलिए आते हैं क्योंकि आपके पॉजिटिव कम होते हैं. रिमेंबर दिस, देयर इज अ नीड ऑफ पॉजिटिविटी. नेगेटिविटी तो ऑलरेडी बहुत है. There is a need of positivity, right? So we have to work on increasing our positive. And when will our increase our positive? When we will have a higher attempt. But yes, um, if I give you a lower margin, भाई 180 से नीचे तो बिल्कुल नहीं जाना. बट अभी यहाँ पर प्रॉब्लम है, 180 कर नहीं पाओगे क्योंकि 40 क्वेश्चन है हर सेट में, है ना. 40 क्वेश्चन है तो 36 क्वेश्चन से नीचे किसी भी सेट में नहीं जाना. कम से कम कोशिश करनी है 39 अटेम्प्ट करने हैं हर पार्ट में. 39, तो 36 टू 39 पर पार्ट में अटेम्प्ट करने हैं. 39 से ऊपर अटेम्प्ट किए तो दैट्स अ वेरी वेरी गुड सेफ एरिया फॉर यू.
तो गाइस, इतना कुछ बता दिया हमने लास्ट मिनट के लिए. तो अब ये सारी बातें आपने सुनी है. अब सिर्फ क्या करना है, अपने आप को सुपर पॉजिटिव रखना है. अपने आप से आज से लेके कल सुबह तक सुपर पॉजिटिव बातें करनी है. अपने आप को मोटिवेटेड रखना है और अपने आप पर बिलीफ रखना है. ठीक है ना. अगर खुद पे भरोसा नहीं करोगे तो तुम्हें कोई पार नहीं करा सकता. और खुद पे भरोसा रहेगा तो 7 खराब इनिंग के बाद भी विराट कोहली की तरह जितने भी रन मारे थे, टॉप स्कोरर थे विराट सर तुम्हारे, तो वो रन मार के बाहर निकलोगे और मैन ऑफ द मैच तुम ही बनोगे. तो अब कल मैन ऑफ द मैच बनना है सबने. पूरी भाटिया टीम, पूरी भाटिया फैमिली तुम्हारे बेस्ट स्कोर के लिए प्रे करती है, तुम्हें ब्लेसिंग्स देती है. एंड आई थिंक यू हैव वर्कड सो हार्ड. सक्सेस तुम्हें मिलेगी ही मिलेगी. ठीक है ना, उस पर कोई डाउट नहीं है. अब तो सोचना सिर्फ ये है कि एम्स दिल्ली में मेडिसिन उठानी है कि मैम से मेडिसिन उठानी है. ठीक है ना, इससे कम कुछ नहीं सोचना. और कल आओगे वापस, अगर रिकॉल देखना चाहते हो, कोई प्रेशर नहीं है. घूमना है, जाओ घूमो. बहुत मेंटली आई थिंक सब पागल हो चुके हो, हम सब पागल हो चुके हैं. बट अगर रिकॉल देखना चाहते हो तो डीबीएमसी के चैनल पे कल शाम को रिकॉल होगा, एनालिसिस भी होगा. अपनी एक बार परफॉर्मेंस एनालाइज के लिए देख लेना. अदरवाइज मैं रिकमेंड करूंगा पर्सनली, जाओ थोड़ा चिल करो. ठीक है. सो थैंक यू सो मच एवरीवन. गॉड ब्लेस यू. यू आर गोइंग टू डू अमेजिंग. थैंक यू सो मच.
ऑल द बेस्ट एवरीवन.